Megan. So my name is Maddie. I'll be working with you today. Is it okay if I work with you?
Mm-hmm.
All right, how would you like to be addressed?
Megan.
All right, Megan, so we're going to do a few tests today. So the first one we're going to do, we're going to use this little bag. There's some objects in here. I'm going to have you reach in with your eyes closed, grab the object, and you just tell me what the object is. The second one we're going to do, you're going to have your palms facing me. I'm going to draw some letters on your palm or a number, and you're just going to tell me what that number is. Okay, so we're going to start out with the bag one. I'm going to have you close your eyes for me. I want you to reach in with this hand, grab an object, take it out, just move it around with your hand, and I want you to tell me what that object is.
That is a pin.
Pen, okay. Perfect. Now let's use this hand. I want you to reach into the bag and tell me what this object is.
That is a safety pin.
Alright. Alright, now I want you to keep your eyes closed. I want you to lift your hands up towards me. I'm going to do this in random order, whichever hand. I just want you to tell me what letter and number I'm going to trace, okay?
Okay. 3. T. 4. G.
Okay, good. Alright, so that's the end of our testing. You open your eyes now. Alright, so the first test that I did with the bag, that was stereognosis. That was just her ability to discriminate different objects with her eyes closed, just using her hands. The second one was graphesthesia. That was her ability to name the number or the letter that I was tracing on her palm with her eyes closed. So both of these, stereognosis and graphesthesia, I would test if I suspected that my patient had a stroke, a tumor, or just a traumatic brain injury that could possibly affect her ability to discriminate light touch, proprioception, things that are coming from the somatosensory cortex. And with these lesions, they could affect the somatosensory cortex on the parietal lobe. And then there's also a possibility DCML is involved as well, so that would also test light touch and proprioception. And so normal findings with stereognosis and graphesthesia would be her ability to discriminate between the objects that she grabbed out of the bag, and then also with graphesthesia, her ability to say what number or letter that I put onto her palm. And then abnormal findings would be she would not be able to discriminate between the objects she was holding, and then not be able to tell me what the letter or the number was that I traced on her hand. And so structure-wise, like I said before, this could be a cortical lesion problem, specifically in the parietal lobe where the somatosensory cortex is housed, which does all of our senses, light touch, proprioception, pain, temp, all of that. And with specifically these, the DCML tract carries light touch and proprioception, and this is the tract that is carrying the information for stereognosis and graphesthesia. And so I would just want to test these to make sure that those cortexes and that tract is intact. That was it.
That was really good.